Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 11, 2025. This video is on a Lancet article published online first on November 9, 2025, titled Complete versus Culprit Lesion Only Revascularization for Acute MI, an individual patient data meta-analysis of randomized trials. There's an accompanying editorial titled Complete Revascularization in Patients with Acute Myocardial Infarction in the same issue of the Lancet. Acute myocardial infarction with multi-vessel disease was evaluated. What they evaluated was complete versus culprit-only percutaneous intervention, PCI. They included 6 randomized trials in the meta-analysis. The study cohort comprised of 8,836 patients, median follow-up 36 months, 87.9% had STEMI, and 12.1% had NSTEMI. The Cox frailty model analysis was utilized. The primary outcomes was cardiovascular death or myocardial infarction. The secondary was all-cause mortality. Patients were enrolled if there were greater than 250 patients in the trial. Data was extracted and harmonized. What did they find? Cardiovascular death and myocardial infarction was 9% in the complete revascularization group versus 11.5% in the culprit-only group. P-value 0.0001, hazard ratio 0.76. Cardiovascular mortality was 3.6% in the complete revascularization group versus 4.6% in the culprit-only revascularization group. Hazard ratio 0.76. P equals to 0.0091. All-cause mortality was 7.2% in the complete revascularization group versus 8.1% in the culprit-only group. Hazard ratio 0.85. P-value 0.039. MI reduction 6% in the complete revascularization group versus 7.8% in the culprit-only group. Hazard ratio 0.76. P-value equals 0.0011. Key takeaways of the study was complete revascularization reduces major cardiovascular events, robust evidence across subgroups, and the benefits are durable. The accompanying editorial says the core message of this article is complete revascularization reduces cardiovascular death, all-cause mortality, and reinfarction. Nearly half of acute myocardial infarction patients have multi-vessel disease. Prior mortality data were inconsistent. The key findings in this group, hazard ratio for cardiovascular death and myocardial infarction was 0.76. Hazard ratio for cardiovascular death was 0.76. Hazard ratio for mortality was 0.85. And hazard ratio for myocardial infarction was 0.76. The benefit was consistent across age, gender, whether it was STEMI or NSTEMI. So the strategies they used, angiography and physiology-guided PCI, were both effective. Future directions, ongoing trials will refine selection and timing. Clinical pearls, complete revascularization reduces cardiovascular mortality. Effective regardless of timing or physiology-guided strategy. Large-scale individual patient data meta-analysis strengthens the evidence. Benefits are consistent across age, gender, or whether it's STEMI or NSTEMI. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.